PhD, and I think I had half an hour devoted on how to write a survey item. And then I spent so much of my career designing my own measures that I had to kind of delve in and learn how to do this. And I want to walk you through it today. I'm really glad you're here. First, just remember what it's like to answer a survey question. It's a very popular survey question from the SF-12. Just try and answer this yourself. And think about it. Tell me, just call out. I have a few questions for you guys today, so just talk. Like, what's one step that it took you to do to answer this question?
I just ate, so that's good.
You had to concentrate, so now you've had fuel.
Figure out what health is or means.
Great. What's health?
Why is 5 poor?
Yeah.
Say that again?
I said, well, why is 5 poor? I feel like I get bigger when I feel better.
Because you're a little distracted by the numbers and going the opposite direction.
What does very good health mean?
Yeah, what is very good health?
And how is that different from good
Or excellent?
or excellent?
I know, good is kind of subsumed under very good, and there's, yes.
And if I have an underlying medical condition, in general, is it in general for me, or is it in general for the whole community?
Is it my health today or my health a year ago? Or when is my health good or bad?
Right, that's a good question. So this is a lot of steps, and I personally came up with at least 5. I'm sure there might be more, but you have to be able to read it. You have to figure out what on earth is the researcher trying to get at when they talked about health. Mental health, physical health, both together. And then you have to go into your mind and think about, well, what do I know about my health that's relevant to answering this? And then somehow you have to come up with just one judgment. Okay, I think I'm doing fine. All right, now where does fine fit on this? So this is not easy, and this is when I talk today about like cognitive burden. These are some of the cognitive steps that everyone goes through for even the seemingly most simple question. So any text will tell you a few things. I'm just going to get them out of the way. Let's just take these for granted, okay? You got to use simple words. You want simple punctuation. You want words that each and every person who takes your survey is going to define the same way. More specific and concrete you can be, the better off your data will be. If you're giving response options, you want all the response options that make sense so that someone can find themselves in your answer. And they can't overlap, otherwise someone in that overlapping area isn't going to know what to choose. You can't leave them and say, isn't it better when, or don't you think that? And double negatives are a problem. And then you can't have what's called double-barreled items. And so, double-barreled are things, I'm embarrassed to say that I personally wrote these items and have published them. Can anyone find anything double-barreled about these survey items?
Presence and power could be 2 different things.
Very good, yes. Anything else?
Planning and leading.
Right. Anything else? Basically, if you're using the word "and," you should catch yourself. And this is hard. I think personally, when I was writing these items, I was trying to convey presence and power. I'm trying to convey an overall feeling. And I will say the United Methodist clergy that this survey went to, they say presence and power together. To them, that is one and the same, but that is their language. And for that reason, I think that that's probably valid. If I were to just say presence, they might not, or just power. Presence, they'd probably get. If I were to just say power, they might not. That might be confusing to them. But on the other hand, you can see someone feeling very differently in crisis intervention than in counseling. And so researchers now have all kind of agreed that you shouldn't have two barrels going over your waterfall at the same time. All right, so there is this wonderful expert who does research on survey research, and his name is Jean Proeschold-Bell, and unless I just cite him all throughout this presentation, and if I don't give another reference, this is the reference. And he very helpfully summarized his entire 20-odd year career of doing survey research in this one chapter, so I recommend this one chapter if you want to read more. And he came up with this idea that when you've got those 5 steps or more steps and you answer a research question, that people are going to approach your survey in one of 2 ways. If you're lucky, they will be optimizing, and that they're highly motivated and able to take your survey. When I was in graduate school, the joke was that you really wanted to do research with middle-aged housewives. The idea was that they were home, so you could catch them. They were motivated because they were kind of bored, so you could ask them about almost anything, and it would probably seem interesting, and that they were pretty able people. I'm lucky in that some of my research is with clergy, and they're highly motivated. I've had pastors tell me, okay, before I got to the spiritual well-being, the presence and power of God items, I put everything down, and I took a quiet minute so that I could center myself before answering those questions. No one gets that, okay? So that's as good as it gets. More often, think about the last survey you took. The last survey I took, I was satisficing. And satisficing, you just do everything a little less carefully. So you can either be a weak satisficer in Proeschold-Bell's terms, which is where you do go through all 5 steps, but you're not really careful. Or you can be a strong satisficer where you don't even search your memory for everything, and you don't spend a lot of time matching up your best answer with the response options, and you still give an option. So strong satisficers might just go all the way through, and if you've given them a chance to say neutral or neither agree nor disagree, they might just choose all of those. So you obviously want to avoid that. So why do people satisfice? Either the cognitive burden is too hard, or, well, this is still cognitive burden, isn't it? So you're asking them too much in the first question, it's hard, or in the second one, maybe they don't have an opinion. And so now you're asking them to think about something, and if they don't really care about that something, then they're just going to give you any answer that seems reasonable to them. Or they're just not motivated, or they're tired because it's a really long survey and they're towards the end, or they're not sure what it's going to be used for anymore, or they really just wanted to answer. They really just want to get to that open-ended part where they can complain about something, say about their medical care, and they really don't want to go through all your questions in the first place. So today we're going to try and think of ways that we can reduce this cognitive burden or bolster the relevance to them so that you get better survey answers. So you get better reporting if at the beginning you tell them how long it's truly going to be. You're telling people it's going to be 10 minutes when it's really going to be 20. It doesn't help you because they get really frustrated after 10 minutes. Getting them at the beginning, saying something like, oh, there's going to be a variety of instructions. There's going to be a different time frame. Sometimes I'm going to ask you about the past 2 weeks, and sometimes I'm going to ask you about the past month. And if you'd please pay attention to that, I would really appreciate it. Sometimes that helps. If you're actually have the luxury of having an interviewer doing it, and then reading slowly and actually acknowledging when the participant pauses, instead of the participant being embarrassed that they had to think something through, if the interviewer comes back with, oh, thank you so much for thinking that through, then that is helpful. You can also make the survey as personally relevant as possible. And so, so I'm just finished wave 5 of a biennial survey with pastors, and so by now I know they read my thing, so I felt like I could have this luxury of kind of this long introduction. And so this is actually my introduction. In blue, I've kind of highlighted some of the language that I use to make this survey relevant to them. You know, it's the only survey of this kind. We learned from your past answers. On this new one, we're going to ask you about Sabbath and your health as a child. These are things that I believe pastors are interested in telling me about. And it goes on. I even hear apologize. I say, gosh, most of these items were written just for you. But I'm so sorry. Sometimes we want to compare your answers to other people, and then we can't change those questions. And so if you come across an item that doesn't sound like it fits you, I'm so sorry. Please take it anyway. And they even use their own language. Some Christians talk about being good stewards, so I say I'm going to be a good steward of their data. So hopefully they feel connected to me by the time they get done with this, because this is 60 or 75 minutes online. All right, so now you've got them somewhat ready, and now we're going to try and reduce that cognitive load. So I'm going to give some very concrete tips. So what do you do? Like that choice of whether you should have a closed-ended question where you've got like 5 response options to pick from versus just like open-ended where they write in. Where do you go from here? So let's walk through an example for ourselves. Answer this question for yourself. What is the most important issue facing the country today? Right, you got it in your head? Okay, so now can some of you just call it out?
Bad airplane food.
Bad airplane food. What else?
Gun violence.
Gun violence. Gun violence. Yeah.
Gun violence, the right to vote.
Healthcare.
Healthcare. Immigration. There's like so many of these. Now think for yourself. Did something that somebody else called out, does that also seem important to you? So then, if you make this a closed-ended category, I have a lot of people I work with wanted like put down 4 or 5 options and then put other in a blank in hopes that, well, if I didn't get it, then they'll write it in. Well, unfortunately, the studies on that are that people don't write it in. What happens is that if you agree with any of these other answers and you're going through that list, you probably don't take the time to think for yourself what is your most pressing answer. And then as soon as you find something that is important to you, you indicate that. So this kind of leaves you with a quandary. Like you can decide, if it's good enough to just know that it's really important to somebody, then you can go ahead and make a list and just have to put it in there. Or you can spend a lot of time in advance talking with people, your potential respondents, and getting pretty complete lists from them. So you have a long, complete list and hope that they really find it in there. Or you can have them rank if you really care about what order. Or you can just ask it as an open-ended question, and then later you'll have to have staff that go through and code them. For something as straightforward as this, I think you can code it pretty well. Not everything is as straightforward as the most important issue. All right. There are other research on open versus closed-ended questions is that if you're asking about a fact, like how do you get hepatitis C? Is it illegal to do something? If you're trying to get an actual fact, then open-ended is better. There's just studies on that. It's going to take you more time to code, but it is better. Unless people are going to write in that they don't know. So again, here I would give instructions that discourage someone from writing in don't know. And if you have an interviewer, then you're in better shape with that. Now, if you're looking for an actual amount, like how much money did you spend on medications this month? How many times have you gone to the emergency room this year? Like, in those cases, it's better to just leave a blank. What happens is if you start to give categories like, you know, how many hours did it take for you to travel to the doctor, then people have to start to find themselves in these categories, and it actually increases the cognitive burden on them, and they'd rather just write down 3 hours or 1.5. Let's see. All right. Oh, yeah. So there's been a lot of research out there on how many response options do you give. Like, and so, actually, 1 second. So let's go back again and think about your cognitive load. It's like when you're asked a question, you have to first especially say an attitude question, you have to first think, okay, what's the researcher trying to get at? What is my attitude? And then where does my attitude fit on the scale? And so often we think that we're doing people a favor just by saying like or dislike. But in a way, sometimes that actually is harder for people because they're like, well, I don't like it very much. I don't know what to say. So as you think about this, as you write your scales, you need to cover a full range so people can find themselves. You want them in order so that people aren't confused about where they're going, but they can't overlap, otherwise that's going to be a problem. And you really want to know what each point means. I highly recommend that you label what each point is. But when you label them, they can't be too similar. You can't say occasionally and sometimes, or rarely and not very often. Otherwise, people are like, well, I don't know, what's the difference between those? And the problem is that the words that make sense to you also have to make sense to your respondent. Oops, hold on a second. Okay, so, sorry to scare you. So you need to know, when you think about how many points, like do you want 3 or 5 or 7, like you need to think about, do people make fine-grained distinctions about this? And so let me give you an example question. Is your opinion of the president? Here you go. You try and find yourself in here. So if you wanted to say something like moderately negative, it's not in there. Or moderately positive isn't in there. If you're extreme on either end, you're not in there. And if you're not making a really fine distinction, like it might just be fine to be very negative or very positive, but if you're extreme on this, then this actually might take you longer to fill out. And as a researcher, you will get better data if you understand, if you give a more extreme option. In terms of the question of like, should you label each of those 5 or 7 response options, the answer is yes, you absolutely should. And studies have found it's pretty easy to do that for up to 7, and people will read and understand up to 7. It gets harder once especially at 11, it gets much harder. There is one study that showed that if you have 4 or 6 response options, that you got more missing data with 6, but at the analysis stage, the findings came out to be the same. So somewhere in between there is quite fine. There's a lot of popularity right now using thermometers. So some of you on like medication adherence for HIV medication adherence, sometimes you have like a scale that goes to 100 and someone marks how accurate they are. In popular opinion polling, AIMS, the American National Election Studies, does this feeling thermometer. And I will say John Krosnick is not happy with the feeling thermometer. So he would say, like, what does it mean to be a 48? Somehow you're in between no feeling at all and a bit more cold or unfavorable. Like, what does that mean really? And so here's a published finding that uses this feeling thermometer. And so the question that white participants were asked, do you favor, oppose, or neither favor nor oppose the U.S. making free trade agreements with other countries? And then they were separately on the feeling thermometer, they were probably asked, like, how do you feel about President Trump? And mark a little X on the feeling thermometer. And then the way they bring those two questions together is for people who either really don't care or favor free trade agreements. Like on the feeling thermometer, they're about a 42 for Trump. Not really sure what that means. They get higher when they start to oppose free trade agreements, but then even there, you're hovering around no feeling at all. It's just kind of. You can see a trend here because it's over time, but you can see a trend with the better survey item as well. So yes, I told you should label the 7+ response items. Here's why. The respondent goes through all of this. they are actually going to have to try and figure out what you mean by a 4 versus a 5. And so by the time and then they have to figure out what their answer meant with the 4 or the 5. By the time you do all of that, it's just better for you to provide the labels for your respondents. So summarizing across the literature, moderately long, meaning about 7 items, might be the best. There's some studies out there that have found that 5 is better than 7. It depends. Longer scales make it less difficult for you because you can find yourself on there. Studies on reliability, that is, if you give someone the same question a couple weeks apart, do you get the same answer? Or if you've done like an in-depth interview with people and you know that 2 people feel the same about an issue, do they show up the same way on your attitude item? Like in those cases, there's a benefit to having at least 5, but more than 7 doesn't seem to help. And and I'm sorry, validity is where the 2 people really agree. Is you have to have more than 3. 3 just is not enough. So now let's talk about the neutral category, right? We've all done surveys where you've got the neither agree nor disagree, and I often, as a survey writer, wonder if these make sense to do. So here's our example question here that's got a neutral. Personally, I think this is okay. It's somewhere in between. I'm not sure I love the word neutral, but it's somewhere in between, and that probably makes sense. The research on this is that if you have a satisficer, do not give them the neutral option, because they will just pick the neutral option. They'll feel like they're giving you close enough to what you want. If you have an optimizer, then you actually are probably better off letting them say neutral, because someone might truly feel neutral about it. And they've done research that if you don't give optimizers the neutral response, they spend a while figuring out whether they want to go slightly more favorable or slightly more negative, and they'll bounce around there, and they'd be better off with the neutral. Let's see, if you're asking things by phone or with a live interviewer, you have so many more options available to you. And then if you're trying to reduce the cognitive load, really the best thing you can do is to first say, do you feel positive or negative toward our president? Let them say one or the other. If they feel neutral, they will tell you neutral. And then you can be like, okay, this is a true neutral. And if they say positive, then you say, well, how positive? You know, a little, very, extremely, and while that seems like a lot of questions, for them it goes really fast because you've broken down that decision point of positive or negative. There are some times where I just think neutral responses do not make any sense at all, and they usually come up when you've got the strongly agree, the strongly disagree scales. So this is a gratitude measure, and let's just take B for a second. On a daily basis, if I had to list everything that I felt grateful for, it'd be a very long list. What does neutral mean? This doesn't make any sense. I can see why you could strongly agree or disagree with that, but it doesn't make any sense to be neutral. And so, so I'm going to tell you now what is so wrong with the agree and disagree scales. My whole team is smiling because they know I hate these so much. So one thing that is wrong is that we are human beings who want to say yes. It's just in our nature. So if you give someone the opportunity to agree, they are more likely to agree. And so here are reasons why people agree. Here are 2 questions that in theory should give you different answers. So individuals are mainly to blame for crime, and society is mainly to blame for crime. And when you run these through surveys, let's say 52% of people, this is true, so 52% of people in this survey agreed that individuals are mainly to blame for crime. So then you should have, that same 52% should be probably disagreeing that social conditions are mainly to blame for crime. But it's not, it's actually much lower. And so John Krosnick has done work, and across 25 different studies, he's found that there's about a 10% just say yes response. That's one reason not to let people just agree. The other thing is there is now a real wealth of literature out there that they're just not as valid. And the reason why you don't get as accurate of answers on the strongly or disagree is in part that there's a really high cognitive burden. So here's one of those gratitude items. Every day I'm grateful to a wide variety of people. And so first you have to think about, okay, so what's underneath this? Maybe it's how grateful I am. Or it could be how much gratitude I have. Maybe that I have a lot. I don't know. Or could it be how often? Because it says every day. Like, so somehow you have to figure out what is the researcher really caring about. And then you have to think about how you feel about it, and then you've got to pick their response. And again, this is pretty exhausting. But there's a way around it. And so, I know this is a little small, but don't worry, I'll read it. I was recently given one of those surveys that I was satisficing through, and this is because me and my colleagues and I published in the American Journal of Preventive Medicine, and they made me fill out this survey for them to do that. And so, so for example, some of their questions are, my colleagues think highly of this journal, and the paper published in this journal is amongst the best of my recent work. And they're trying, this makes it easier on them because it's all on the same strongly disagree to agree scale, but you could actually tease apart what's the underlying dimension for each one of these. So let's just take one as a group. Let's take the third one. This journal is widely read by researchers in my area. I guess that's the fourth one. I think they're getting at like how many researchers in your area read this journal, which is pretty different of an underlying construct than some of the other ones. I'm gonna let you do this in a second. Let's see. Peer review. The reviewers' comments from this journal were useful. They're really trying to get at how useful this was, and it'd just go faster if you knew how useful. So let's take one that you all can read right now. The journal is well managed by the editors. So, any ideas of like what the underlying construct is? And don't feel bad if someone call it out, but don't feel bad if you don't get it right. These things are kind of, they might not be the best written survey questions.
Editorial integrity, or?
Editorial integrity. So is it how often they have editorial integrity? Is it how much?
All of the above.
All of the above? Maybe we just can't tell, because it's kind of, when it's on the strongly agree scale, it's really hard to tell. I might say it's how well. So one of your choice points, once you decide the underlying construct, and for you, because it's your survey item, you will know. It's hard for us to guess because we're not in these people's heads, but when it's your item, you're going to know what you care about. And so if it's how well, then you then have to decide, do you care on two dimensions, on two poles, like how poorly and how well, would probably make sense actually. So if you've got a bipolar item, I would rewrite this. How well or poorly managed is the journal? And then I'd give response options that would let them see different gradations of poorly managed and different gradations of well managed. That'd be one way. I'm gonna have you do one more. All right, the editor of this journal is well respected in my field. So first you gotta think about like what's the underlying construct here. So think for a second. So anybody want to take a guess? It's truly a guess because we're not in their heads. Oh, yes, please.
If editors in a certain field are respected or they're not respected, so how well they are.
So it might have to do with how much respect. And my mind also went to like, is it how much respect, so it's just one poll, or is it
Really.
how much respect or disrespect, in which case it could be 2 polls. And I think either would be a fair way to go. I often when I think of how much, just keep it one direction. But I think either would be fair. So like, how much are they respected? And you could go from not at all to extremely.
When might you decide to choose to go? Do you always prefer uni, or sometimes by like having respected and disrespected? What's the difference in the cognitive load?
Right. So I prefer bipolar if it's truly bipolar. So like when we can definitely tell, like here, where you can definitely be poorly managed and you can definitely be well managed, I think it's proper and important to do bipolar. When you can't really tell, then I think it might actually be unipolar. But if you really wanted to know if people are disrespecting your journal, then you might choose to make this bipolar too. Usually it's clearer whether it's unipolar or bipolar. Let's see. So I do want to say too, there are a bunch of measures out there that already don't do the strongly agree and strongly disagree. And so like this is an anxiety measure, and all the questions are getting at how often. So there is still that ease of repetition for the participant, and they can still see the same response scale over and over again. And what I have taken to doing is figuring out what all my questions are, and then I group the how often's, put them there, and I group the how muches, and I put them there with the same response option. And you can do this. It's really not as hard as I just made it seem. If I present on this again, I won't choose poorly written, what do you think of my journal items as examples. It's really much easier than that. Okay. Tell you what, before I move on to the don't knows, does anyone have any questions about the strongly agree and disagree items?
I have a question related to satisficer and optimizer.
Yes.
So when you try to choose your questions or how you express them, you have to survey, you have to figure out who your population is to, like, do you have to, yeah, how do you do it?
That's a great question. You absolutely should, and I'm going to get there. But yes, there are all these steps you should take in advance about identifying your population. You can make your communications specific to them so that they'll be more likely to optimize, and you should pre-test your questions. And so I've got 3 ways to pre-test questions, so hopefully we'll get that. One thing people also ask me in writing a survey question is, should they allow a don't know response? And so people select don't know for a bunch of different reasons. They might just not be motivated. They might have a hard time figuring out your question. They might not know much about it, so they say that they don't know, when in actuality they know something. They might know quite enough for you. They might be embarrassed by their answer because it's going to make them look bad, like, did you volunteer last year? Maybe they'll be embarrassed if they say no. Also, sometimes we, the researchers, add language that make it worse. So like if we say, or haven't you thought enough about this issue to have an opinion? That's basically sending a signal that people need to think a lot about this before they can give you a satisfactory answer. So then people are going to say, okay, I haven't thought enough about this, because you're the researcher, you think about this all the time. So again, most of these, if you have a satisficer, they're going to just be more likely to turn to don't know than if you have an optimizer. And so, so in general, it's better not to have the don't knows. The times when I think the don't knows help is if it's factual. If you want to say, you know, how long are people from Mexico allowed to stay in the United States if they have a H-1B visa or something like that? If you're looking for a very specific, you know, then someone should be able to say, I don't know. Let's see. Okay. What about those response options? So you've got your 5 or 7 response options. People have studied this, and it is true that if someone is seeing them in writing, they're more likely to choose the early ones. So if you're giving a list of your most important issue for the United States right now, like people will pick ones towards the top of the list. If you're reading it to them over the phone or in person, they'll pick ones towards the bottom of the list. I'll have a really good solution for you there. Just saying that is true. And then, of course, you also, if you have a long survey, you have to pick what order you put the items in your survey. And there, satisficers are going to be less careful toward the end. So I like to put my most important questions early on. Therefore, I put the demographic items at the end, because I figure by the time they get to that, someone can really quickly run through them. However, it's really interesting. If you've got an interviewer, they can be really engaging, and they can keep people on the phone or in person longer, and then it doesn't really matter so much whether your items are early or late in your order. Now I'm going to run through a couple different ways that you can get more accurate answers. And so the order of your survey questions also can help you get more or less accurate answers. So people actually learn from surveys. I can't tell you how often I hear from my wonderful interview staff that some people out there actually really enjoy taking our surveys. We've got one out there right now for people who drink alcohol and have hepatitis C, and they get something out of this experience with an interviewer, and they are learning as they go. Like, we are all questioning, thoughtful human beings, and so if you start a little more general in your items and then get a little more specific, they're getting more and more of an idea of what you're talking about. Also, if you're asking about, like, I don't know, relationship satisfaction, and you ask about all different kinds of ways that someone can be happy or not happy with their romantic partner, by the end they're like generalizing, this is what this researcher thinks about happy relationships. And then you say, are you happy about this? And they're like, now I know what you mean. And so in that case, you might actually want to end with the general item, because they have had a true sense of what you're going. But you really have to be very careful about this. This is one of those tricky things. This slide in particular I struggled with, because there aren't easy answers. This is where you have to be like super thoughtful about your own research and the whole context that you're doing. Because let's say that you just asked a bunch of questions about being married or romantic partners, and then you ask this general question. So overall, how satisfied are you with your life? People might really just be thinking about their relationship, and they're going to miss the fact that you're now having them step back and think about their general life. So you'd be better off putting that general question early. So, I mean, as a rule of thumb, you might start more general and get more specific, but that doesn't always work. Let's see. Now, social desirability. You know, there are answers that we have that can make us look bad. I've done a lot of HIV research and different kinds of unprotected sex and different having more partners. Like, all of these things can make people feel like they're looking bad to the interviewer. And one of the best ways to get around the kind of social desirability where you're trying to make yourself look as good as possible is if you can self-administer something. If you are really sure it's anonymous. So I usually put language before, Like even if I told them at the beginning of a survey it's anonymous, right before I ask these really personal questions, I come back again and say, remember, there's no way I can track your responses back to you. There is this technique, I've never used this, but it's called the bogus pipeline, where you tell people that you have another way of finding this out. So we don't do this on our hepatitis C project, but we could say, remember, we're going to be screening your urine, which we do for alcohol use. So you might as well tell me the truth about how much you've been drinking, because we're going to know one way or another. Let's see. There's another kind of social desirability, which is where you don't even want to look bad to yourself. Like you don't want to admit to yourself that you have unpleasant thoughts about other people. I get this with the pastors I survey. They don't want to think that they're criticizing other people. And so there's no real solution for that, I'm sorry to say. Okay, let's see. Now, how to be more accurate if you're asking people things like, how often have you been to the doctor? So, I ask the pastors like how much money they make, and I let them get up and go look at their tax returns. Not everyone will do that for you, but let them search the records. Shorter time frames are better. The more frequent the occurrence, the shorter your time frame should be. So something like going to the doctor or the emergency room, hopefully that's not that common and you can probably go out 6 months. Something like how often do you talk to a family member might be so often that 6 months is going to be useless data. Calendars can help, reminding people of holidays and birthdays and big events like September 11th, all of these things can help. There is also a technique where you can ask about 2 interview periods. You can say, so how often did you go to the doctor in the last month? And then how often did you go to the doctor in the last 6 months, so 5 months before that? And you can just, by separating that out at the question stage, later you can say, I feel really good about what the answers for the last month. And I'm not so sure about the other time period, but at least I have some information on it. It will help you interpret it. Oh my goodness. How many times have you seen a question like this? During the past 12 months, how many times have you seen or talked with a doctor or medical assistant? This is just, you are just not going to get the most accurate information. If you have an optimizer, they're going to sit there. So sit there and think for a second about like what you could separate this out if you're going to make it into more questions. There's so many different ways. This should really be more questions if you want good answers. So that's one strategy to get more accurate. Another is don't just say like how often have you received education, or sometimes you'll see these for like trauma items, like have you ever experienced trauma? Have you experienced any trauma in the last month? And like if you spell it out, if you get kind of specific about what you mean by trauma or what you mean by education, then you will get better answers from everybody. All right, finally, I'm back. I'm down to 3 different ways that you can make your survey better in advance. And so I will say I recently went to a conference that caregiver project I'm part of brings together philosophers and psychologists. And for the philosophers, for the first time, they're like, oh, wow, you can ask people survey questions and get tons of data back and so much to interpret. And they were like so excited. And I tried to do a survey consult with one of the philosophers who was asking for it. And I talked to him about some of this pre-testing. He was like, that's okay. I don't have time for all that. I'm just going to ask them questions. And I looked at his questions and I'm like, oh my gosh, he's going to have no idea what he's getting back, because they were very philosophical about the good life and well-being and oh my gosh. So it does take more time, but no one's going to believe his interpretation of his responses. So the easiest way that you can pre-test is you can give your survey to an expert. This could be someone who's done research in the field. Ideally, it's also some of the very kinds of people who would be participating in your survey. and have them go through it and have them tell you a number of things, like what's confusing, what words did you not know for sure how to define. You can go a long way with that. I don't think it's enough, but at minimum, please do that. In preparing to talk to you guys today, I did learn that there are like online softwares out there. So here's one that I experimented with, and you can go in. Here's a screenshot. Sorry, it's a little small, but I cut and pasted in from my Hep C project a question during the past 30 days that is said September 2nd. How many days have you used heroin? And then it gave me some feedback on this question. So it said, heroin might be a technical term. It's probably not to my population, but you know, it gave a flag, and then you could ignore that or look into that as a researcher. They weren't sure past 30 days. Obviously, it's not thinking very hard because they didn't catch the fact that I defined what I meant by past. But it did that. And in terms of like the answer, number of days. So this is one of those places where I gave an open option. I didn't make anyone go into a category. Just said, you tell me how many days. Then said, question, answer looks good to me. All right, so here's another one from that same study. And the question was too long, so it kind of got cut off. But about how much in total did you pay out-of-pocket expenses for health insurance premiums? And then we got this whole list of things. Please don't include co-pays, and Christina could probably like rattle the whole thing off. And they were just like, okay, co-pays is ambiguous, deductibles ambiguous. What do you mean by coverage? What do you mean by amount? So they probably want you to specify dollars, which I think is actually fairly clear. And then they have this little flag, working memory overload, which is probably there. In good news, we have a real live thinking interviewer to help walk them through it. But if this were on a survey, that would probably be information overload. So this is what some of those tools out there could do for you. So you could do that paired with expert review. If you were actually going to have someone take the survey while you're there, you could see how long it takes them to take certain items. And if certain items are taking a long time, that's a red flag. You could talk to them afterwards about what their experience was. And then you could do my favorite. And so I had a colleague who had gotten her master's in public health from UNC, and they had taught her cognitive interviewing there. And I learned all about it, and I love this process, and I do it regularly now. And so here are some cognitive interviewing references if you want to learn more about how to do it. But you basically, first you train your participant on how to be helpful to you. So you say things like, so I'm going to try and get at how you think when I ask you a survey item. So let me tell you how this would be. Let's say that I asked you how many windows are in your home. So what I'd want you to do is I'd want you to kind of visualize yourself in one room and think of how many windows are in there, and make a note of it, and then I want you to walk into the next room and see how many windows are there, and I want you to add them all up and tell me how many windows. Okay, so you've now trained your participant. And then you go ahead and you give them the survey item. So let's see. So here's an item from the perceived stress scale. In the past month, how often have you felt upset because of something that happened unexpectedly? Know your response options. So have them take it. And then you ask them, okay, so what were you thinking while you answered that? And you get their answer, and it gives you a sense of whether they're thinking the same thing that you think they are. You know, are you guys aligning on the same meaning? And then you say, okay, so what does upset mean to you? And then there's this term like when things happen unexpectedly, what did you think about when I asked you about things that happened unexpectedly? And then you might ask, okay, so I saw that your answer was fairly often. What would it have taken in your life for you to have answered very often? And if you do this for every item, then you can end up changing the language so that you're sure everyone's understanding. So what I like to do when I create a whole new survey is mostly I take items from other scales and I read the journal articles on those other scales, and I hope that they've been very careful and not many people have done it. And then when I make up my own items, I go through this process. And then I have learned the hard way that when I ask the perceived stress scale to pastors that they can't answer it, because when they see something like, how often have you felt upset because of something that happened unexpectedly, they're kind of like, well, I shouldn't be upset because it's all unfolding according to God's way. So I want to deny that I felt upset, and it wasn't unexpected to everyone, and they kind of get all twisted around, and like they just absolutely can't answer this question. And so if I get unexpected data back on a survey, then I will sometimes go and just ask 10 people some of these questions, and then they can help, and then I'll figure out if anything works. One item works on the perceived stress scale for pastors, and that's how often you feel on top of things. So let's see. So I think that's it. We have like 5 more minutes if anybody Yes.
Do you have an opinion about incentivization or incentivizing survey responses? Or giving people things to fill out surveys?
Incentives?
Oh,
incentives. Sorry, yeah.
Oh, yes, they're wonderful.
Yes.
Yes, I really do. I mean, if you can't afford it, and then you keep the amount something that's not coercive, meaning that people feel like they could walk away from it, then I think that it really does help people, and it probably helps them optimize. If that's what you're getting at. I think this is great. The only times that I'm careful not to incentivize or compensate is if I think I'm going to be doing research with that population for a really, or like, so recently the Divinity School has asked if I'll do a survey with them, but I'm afraid to pay the Divinity School students now, because if I pay them, the Divinity School is probably never going to pay them in the future. And now they're because they just don't have the budget, and then those students might be less likely to take it or might satisfice it. That's one caution. Otherwise, time is valuable.
But if you offer incentives, wouldn't you also have that risk that they are more likely trying to find the correct answers that you are looking for, so that, because you give them something, so they want to make sure they answer the questions that you want to hear?
Oh,
So
I hope that they, by paying them for their time, I hope that they'll take the time necessary to give me the most thoughtful, hopefully most accurate and true answer. And if your question is, do I think that they'll tell me what I want to hear? I don't know any studies on that, so this is just my instinct, but I don't think they would try to do that if I made it. Maybe they're anonymous, or if I make it clear that I just really want to know what's going on. But there is that problem. People do tell you what you want to hear.
If you find yourself in the room with a satisficer, should you find them help or like materials?
If you're in a room with satisficers?
Like with a satisficer. Like I feel like they're like some kind of group of people who like really need help or something.
Oh, well, so if
Sorry, I was joking too.
Okay.
Like throughout this whole talk, I've been like conceptualizing sacrificers as like this group of people who like really need help, and like they shouldn't be taking surveys.
And really, they can be your very busy professional, or your very busy low-income person who said, I don't have time to do this, or because, yeah.
Apologizing to the doctor.
Like maybe there's a sacrificing anonymous that they can go to.
thank you. That's great.
Or satisficer.
If you talking about the cognitive interviewing, would you also do that while you already started your study and you handed out, 100 surveys, and then you see, well, it all went fine in the pre-testing, but now, like you said, with the past starts, now I realize it's not working. Can I still like tweak my survey when I already started the study, or is it then too late?
Oh, I know, that's such a good question. So, yeah, so the question is, if you find out something's going wrong in the middle, is it too late? And I would say it's better to have good data than bad data. And so probably I would make it, I then have to make a judgment call. If it's just going to make the data a little bit better, I might not change it. At whatever point you change it, you almost have to analyze both sets of data separately and then decide if you can combine them or not forever. You might have to report them out separately. But if it's going to make it much better, and I doubt the quality of the first set, then it's absolutely worth changing it.
How about taking just one question out?
Oh yeah, so sometimes that, like if somebody has a measure, like I recently did this, there's a positive mental health measure, the mental health continuum short form, and I didn't think that the questions covered the full spectrum of what my population wanted to answer. So I used those full 14 items, and then I added 3 of my own. And then I looked later to see whether the relationships, like the correlations and such with my other outcome variables, did they get stronger or improve by adding those 3 items? And they did not. So I thought I was so smart.